Hi, this is Christopher King. I'm one of the advanced lung disease doctors at Inova Fairfax Hospital. I'm going to talk to you today about a common clinical problem that we all face, and that's differentiating IPF from cardiovascular disease. It can be a difficult thing to sort out because the clinical presentation can be very similar. So these patients often present with nonspecific symptoms like shortness of breath, reduced exercise tolerance, fatigue, or cough. And when you're faced with that situation in clinic, how do you get from that history through a streamlined series of tests and figure out the diagnosis? They also have similar risk factors, and so it's often men over 60 with a history of smoking. That patient group is at risk for both of these disease states. The physical exam can be very helpful. So if on lung exam you hear Velcro crackles, that leads me toward a diagnosis of IPF. Also, if I see digital clubbing, then I would think more about IPF and less about cardiovascular disease. Things that might suggest cardiovascular disease are historical things like the patient's complaining of orthopnea or paroxysmal nocturnal dyspnea. And then things on physical exam that might steer you more toward cardiovascular disease are lower extremity edema or elevated JVD when on neck exam. If I'm suspicious of IPF, the first test that I frequently order is pulmonary function tests. And so with that, you would expect to see a restrictive pattern, which is reduced forced vital capacity and oftentimes a reduced diffusing capacity as well. Now, having normal pulmonary function tests doesn't necessarily rule out IPF, and so it's important to maintain a high index of suspicion. Some patients may be presenting with mild disease, or they may have combined pulmonary fibrosis and emphysema, which can give you a pseudo-normalized forced vital capacity. If I remain suspicious, the most important test to order for IPF is a high-res CT, and that will show you evidence of interstitial lung disease. If I'm thinking that the patient has more cardiovascular disease, there's a number of cardiovascular tests that may be helpful in determining that. So ordering a BNP, and if that's elevated, could be suggestive of congestive heart failure. An echocardiogram can also be helpful. It may show a valvular disease or a reduced ejection fraction or evidence of impaired relaxation that might imply congestive heart failure. You may also pursue testing to look for evidence of ischemia through stress tests or left heart catheterization. Again, just because somebody has one of these conditions, it doesn't rule out the other. In fact, patients with idiopathic pulmonary fibrosis have an increased incidence of cardiovascular diseases to include congestive heart failure, coronary artery disease, and arrhythmias. And even if the patient has IPF, don't discount the fact that they may have concurrent cardiovascular disease. And so you want to maintain a high index of suspicion for both conditions and do these advanced tests to arrive at the correct diagnosis.